Our next task is bilateral eye pains. Bilateral eye pains. In this particular case, you're an FY2 in a GP practice. You've got a 19-year-old woman who was presented with bilateral eye pains. So she has got pain in both eyes. She also has got yellowish discharge in both eyes. She experiences, sticky eyes in the morning or matting of the eyelids in the morning. She noticed the problem started 2 days ago when she slept with contact lenses. Okay, so 2 days ago she slept with contact lenses. The next and then the next morning she noticed that she's experiencing pains in both eyes. She has got yellowish discharge from both eyes, and it is sticky eyelids in the morning. She is a student. Okay, she has got blurring of vision, and she's worried about her exams, which are coming up in the next few days. Or she's supposed to go for studying in the next few days, and she's worried because she has got blurring of vision. At the moment, she cannot read it properly. Approach to the task. We're going to take the history of the eye pains. Okay. When did she start experiencing eye pains? Yeah. Clarify, is it in one eye or both eyes? Are there any other symptoms? Ask about other eye symptoms like any discharge, any redness, any itching, any matting of the eyelids in the morning. Is there any foreign body sensation in the eyes? And of course, most importantly, the red flags that may include is the vision affected. Think in terms of the differential diagnosis. Bacterial conjunctivitis, yeah, you'll be asking about any discharge, the color of the discharge. This particular patient has got yellowish discharge. Also ask about the recent flu-like illness or coryza symptoms, that is running nose, fever, sneezing, cough, okay, and redness of the eye. That would fit a bacterial conjunctivitis. Yeah. Then what else in there? An acute closed angle glaucoma, where there's an eye pain. Ask about nausea and vomiting. Is vision affected? Yes, this particular patient has got reduced vision, but it is unusual to have an acute bilateral glaucoma. Usually it is unilateral. This particular patient has got bilateral, blurring of vision, and there is no nausea and vomiting. Okay, he has got redness in the eyes though. Keratitis, bacterial keratitis, it will cause eye pains. It can be bilateral, there will be blurring of vision. Now, the risk factors include, of course, use of contact lenses, especially sleeping with contact lenses or swimming with contact lenses. Okay, so this particular patient noticing that the eye pains, the discharge, or the symptoms started after she slept with contact lenses. So that may suggest more of keratitis, bacterial other than viral. Okay. Now, you also ask about the previous episode of ocular herpes simplex. Now, generally, the herpes simplex keratitis, okay, tend to occur again. So a previous history is important, though it usually follows a flu-like illness, running nose, sneezing, or cough, rather than use of contact lenses. Sleeping with the contact lenses suggests more of a bacterial cause. The other differential diagnosis to think about is anterior uveitis or iritis or simply uveitis. There will be an eye pain, but the typical findings is the presence of other systemic diseases, such as ankylosing spondylitis, for example, an inflammatory bowel disease, SLE, rheumatoid arthritis, Behçet's disease. So an anterior uveitis or iritis, usually the patient has got a systemic disease. Foreign body, patient who have a history of of course, experiencing something entering the eye, and you have a foreign body sensation. But remember, a conjunctivitis, bacterial or viral, or keratitis, they're all going to give you a foreign body sensation. Okay, so you have to look for other differential diagnoses. Apart from that, we need a systemic review. Generally, why we need a systemic review? Because, eye symptoms could be manifestation of a systemic illness. Okay, so systemic review here is crucial. Plus, you finish the rest of the history, the PMF, the eyes, the effects of symptoms. And we mentioned that this particular patient, the vision has been affected. She has got blurring of vision, and she's worried and concerned about how she will go for her studies in a few days' time. Examination. When you perform, you need to explain when to perform the examination. That would include, of course, checking the visual acuity. So I need to check your vision. I need to look at your eye, do inspection. I also need to have a look at the back chamber of your eye, which is a fundoscopy. Then you'll be given a picture, as you can see on the screen. So what you're seeing here, the whiteness you're seeing in here, these are the signs of the keratitis, as you can see. Okay, in here, the signs of keratitis. Yeah. So, but of course, you may be given one picture and and being told that the findings are the same on both eyes, or you may be given a picture with both eyes. This particular patient is bilateral, so you may get bilateral similar findings. Diagnosis: explain that he is likely to have a bacterial keratitis. It is an infection of the eye that affects the cornea. Infection of the eyes or the eye that affects the cornea. If sleeping with the contact lenses is one, or use of the contact lens is one of the risk factors, because then you can introduce what? Infection into the eye. So this is most likely the cause. Management. Now, we are in FY2 in a GP surgery. Do not start antibiotics in a GP surgery because there is an eye discharge. So what you're going to explain in here, you're going to refer to the ophthalmologist. Refer to the ophthalmologist immediately. It needs to go now. Okay. Once it goes in there, advise them to take the contact lenses with them when they go to ophthalmologist, because they're going to have to send the contact lenses to the lab to find the cause of the infection. And explain that they're also going to take some swab. They will, don't start antibiotics. This will be started by the what? Ophthalmologist, after they have taken some swab from the eyes. Okay. Usually it involves the use of what? Eye drops, antibiotics. Advise to stop wearing contact lenses until she has been treated successfully. Okay. So again, what will the specialist going to do? The ophthalmologist will take some swab, will start your antibiotics after taking some swab, and of course they will send the contact lenses for what? For assessment to the lab. Okay, the lab rather than the lab in here. So let's just see the change to the lab. Okay, so you can give information about it, written information about it, of course, keratitis. Thank you.